Hello, my name is Ken Plummer. I have a PhD in instructional psychology and technology, but my emphasis has been in psychometrics or measurement and assessment. And over about 13 years ago, we developed a pedagogy at a university called decision-based learning. And I'm going to present that to you now with a particular emphasis on its role in respiratory therapy. So to begin, let's talk about four types of knowledge. There are many knowledge types in educational psychology, but here are the typical four. The first three should sound pretty familiar. Declarative knowledge is the what. These are the facts, the vocabulary of a discipline. Procedural knowledge is the how, the step-by-step algorithms, the methods, the techniques. Conceptual knowledge is the why, the theories, the models, the frameworks. And then there's this more obscure knowledge type in the literature called conditional knowledge or the when. Now, conditional knowledge is sort of what's been called in the literature as the command and control. It's the type of knowledge that directs the other knowledge types. Like I said before, it is the when do I use conceptual knowledge, procedural knowledge, or declarative knowledge. And that is given a certain situation. So it helps direct when these three knowledge types working together are actually relevant in any given situation across all disciplines, across all learning. So decision-based learning targets conditional knowledge directly and systematically. We call it a highly scaffolded scenario-based learning approach. So if you think of scenario-based learning, which is fairly common in applied sciences, particularly like respiratory therapy, which we're very grateful for. DBL is probably the activity you're doing to prep for possibly simulations or preparing for exams that are going to be scenario-based. And it guides the students step by step through a process, giving them access to their own learning analytics so they can determine, okay, where am I weak in my decision making? And then I can get some repetitive practice in those areas of weakness to make them strong. DBL organized instruction, as it states here, around the decision-making process of an expert, which is critical as we go from beginner to an expert state. We have a number of publications over the last couple of years where we've learned a lot about DBL, a lot more than we knew at the beginning. And we've seen the settings where it can be most effective and settings where it's less effective. So this research has been really helpful. We got an acceptance message just last week. This is September 2024. That our article has been accepted in the Journal of Respiratory Care. And so we're excited about that and the things that we learned in a study we did with a large hospital here in our state. We've also published a book back in 2021, and this is just to show you a variety of disciplines that it's been applied in. So I'm going to show you a demonstration right now with arterial blood gas, and want you to know that, as you probably can surmise at this point, that this can be used in any type of decision-making process that's engaged in respiratory therapy. So I will turn to the software here. And let's go right there. Okay, so what you're about to see here is in DBL, we present a scenario. We've got a number of scenarios here. You can have dozens up to hundreds of scenarios that you can create, or we can create with you. And I will say at Conate, there's many different ways you can work with us. We can actually partner with you, our decision-based learning specialist that has some background in respiratory therapy. We'll work with you in developing models, or we may actually have models that would fit your needs and that you may like to use that are in our library of respiratory therapy models. But let me jump right into what the student experience is like. So the student reads a scenario. So here we have a scenario where Mr. Jones is in the hospital, his arterial blood gases are, and then it gives some information. Then the students come down to this question right here. Does the patient in the scenario above have acidosis, alkalosis, or normal pH? Now, they may be able to answer that question right off, but if not, they get what what we describe as just enough, just-in-time instructions. They click on the how do I decide? And there's that question. And they learn about pH in the body. Here they're getting some just bare bones information to determine what lower pH means in terms of the acidity or alkalinity of blood. And then some ranges and more instruction. And that's it. They come back after reading that, they look at the patient scenario and they see that the pH is 7.31. They learned in the how do I decide, or they can just continue reviewing until they learn that that corresponds with acidosis. So we click acidosis, and in this case, they're getting just enough, or excuse me, they're getting immediate feedback. Now we can set the software can be set to various levels of feedback, immediate or delayed feedback, or no feedback whatsoever, in making this an exam. I'm going to show you an example of one where the feedback doesn't actually come until later as they work their way through the model. And here they check their answer and it will show them where they deviated. And so they can start over again and try to figure out, okay, why did I make the wrong decision here? But this example is immediate feedback. And so I click proceed. The next question is the CO2 level high, low, or normal? If I'm unsure, I go to my just enough, just in time instruction, and you can see that's all they get, just the range. And so in this case, I believe that's low. If I clicked normal, I guess in this case, it would normally, I've already been through this one, but the way this would look, I'll show you right here, let's come to this one. Here's another scenario. If you pick the wrong answer, it will just say incorrect. Okay, so let me come back to this scenario. We'll come back here. So I believe we're at acidosis. This was low. And is the patient's HCO3, is there HCO3, and I apologize, I'm not pronouncing these terms correctly, but level high, low, or normal. And so they click on the how do I decide. Once again, they get just what they need to determine. In this case, it is normal. And they see that that's correct. Which parameter is consistent with this patient's pH level? Click on how do I decide again. And they're going to get some more information that's necessary in order to make that decision. And so in this case, I believe this is the correct answer. Then comes the next question. Is this a respiratory problem? Is this a respiratory problem or a metabolic problem? So click on how do I decide? And they learn about respiratory problems. They learn about metabolic problems, and they learn about the difference. And then they return, and if they get the right answer, they'll see that that's correct. The way this is set up, this particular assignment, has the patient's body fully compensated for this abnormal pH? So again, come into the how do I decide and learn about compensation, full compensation. And so actually the answer was no. And like I said, I've already been in here. That's why it's not stopping me if I click the wrong answer. But has the patient's body partially compensated for this abnormal pH? Come into the just enough, just in time instruction, learn what they need to learn. And in this case, the answer is yes. Oh, no, it's no. And then so now we come to the final decision. So all these previous decisions are preparing them for this culminating decision. Now they have to determine which of these is the appropriate way to label the patient's arterial blood gas. Click on the how do I decide, where they learn what's required in order to make this decision. And in this case, the answer is metabolic acidosis, uncompensated. So then after this, they go to the next problem, start over, go to the next problem. I apologize. They'll see it directly like this coming at them with the first decision point. And after a while, as they go through different scenarios that go through different pathways, they begin to automate their knowledge. You can also create quizzes in our software or just use the quizzes in your normal learning management system. The idea is DBL is not designed to necessarily replace what you already have, but to strengthen what you already have. Okay, also, once the students have gone through these a number of times, they can take a look at learning analytics. So imagine I'm a student in this class and I have a heat map. And in this heat map, it ranges from green, which means I've made all correct decisions, to red, which means I've made all incorrect decisions. And here I can see, okay, well, how am I performing? This is not fully green. Let's see how I've done. I've taken 19 scenarios through. I've gotten 13 correct. I've only taken acidosis scenarios through at this point. So it'll be interesting once I get alkalosis in there. Then I go to the next decision point. You'll notice not really green here. So I'm going to look and see. It's kind of a diagnostic experience for the students to determine, okay, where am I struggling when I'm making my decisions? And I look and say, okay, looks like I'm 55% here. And I really struggle when it's been a normal CO2 level. I seem to be struggling figuring that out. If necessary, if you put enough, we put enough scenarios in for you, or you put them in, they can actually practice. And you can put a number of scenarios where these actually become flashcards. So they can actually make it so that they can make it so that the color in their map gets greener and greener and greener. But that's up to them. Now, you as an administrator can look at any individual's map, any one of them. They come to your office, say, I'm struggling with this, that, or the other. You can say, well, let's take a look at your map. Let's see your decision model, how you're performing and where you can use some practice. And so we can come all the way, here's another one. We're at 66%. Once again, I can practice at any point in the decision model. And so this can be very, very helpful for students. In terms of working with us here at Conate, we can provide price points. Right now, we're entering into the world of respiratory therapy. We have a number of clients we're working with. And we would love to work with you as a subject matter expert to determine what models are of interest to you. We have been told that if we can create models that prepare students along with the other curricular elements you have in preparing students for their national board exams, the DBL potentially can provide a lot of repetition so that it can complement the other learning activities you have to really prepare them to do very well on those boards. All right. Well, we look forward to having a conversation for any that are interested and really excited to be working in respiratory therapy. Thank you very much.